There is nothing as precious to man as a sound mind in a sound body, and it is essential that the physical well-being of our people merits as much attention as their spiritual welfare. A thought thereby is Emperor Haile Selassie I, which we can certainly make an important part of our lives. Hi there, thanks for joining us for this edition of Jamaica Magazine. I'm Tamara McHale. In today's show, we'll take a glimpse at how the government will fund Jamaica's national health needs. Plus, pioneering wastewater research at the University of Technology. Also, keeping fit and healthy, Mount Olivet Boys doing it in a fun way. Those and more for you to see after these messages, so please stay with us.
Think before you burn.
The Aedes aegypti is one of several types of mosquitoes found here in Jamaica and elsewhere in the world. Know them. They are small, dark mosquitoes with white lyre-shaped markings and banded legs. The Aedes aegypti mosquito lives in and around places where people gather and breeds anywhere water settles, such as artificial containers in and around homes and other buildings. It's a vector that transmits the virus that causes a number of diseases, such as dengue, chikungunya, and the Zika virus. Find them, destroy them, cover water containers to prevent mosquitoes getting inside. Dispose of garbage containers to prevent water settling in them. And frequently check and empty any container that water might settle to ensure these are kept dry. And scrub vessels clean to get rid of eggs. The Aedes aegypti mosquito. Don't give it a home.
Government has been improving hospitals and providing healthcare facilities to improve access and provide quality care for all Jamaicans. Money has been provided in the recently tabled estimates of expenditure to continue that work this fiscal year. Here's a glimpse of what's in store.
Government is budgeting to invest $54.5 billion in the health of the Jamaican population in the 2016-2017 fiscal year. The bulk of the Health Ministry's budget is earmarked to take care of housekeeping or recurring expenses. That includes things like paying employees and ensuring that government's network of 23 hospitals and over 336 health centers and specialized institutions have what they need to service the population. As it works towards improving Jamaica's health profile, the responsible ministry has set aside just over $28 million to fund capital projects this year, supplemented by approximately $1.3 billion to be earned from the National Health Fund. Most of that is earmarked for the Health Services Improvement Project. Under that project, government intends to procure a hospital management information system designed for polyclinics, provide vector control support, rehabilitate healthcare facilities, and acquire a linear accelerator for cancer treatment. Another $24 million will be spent to improve the water supply at the Bellevue Hospital. Government is also getting $1.5 billion in budgetary support from its multilateral and bilateral partners this year. $361.58 million is earmarked for a project aimed at promoting safer sex practices among groups at high risk for HIV transmission. It's funded jointly by the Government of Jamaica and the United States Agency for International Development. Among this year's targets are finalizing and disseminating the National HIV/AIDS Workplace Policy and providing clinical assessment of and antiretroviral treatment for HIV-positive adults and children. Another initiative, the National HIV/AIDS Response Project, will receive $624 million in support from the Global Fund. Its goal is to reduce AIDS-related morbidity and mortality through biomedical and supporting interventions. The European Union will also continue its funding of the Health Ministry's program for the reduction of maternal and child mortality. This year, PROMAC is getting $501 million to continue work on neonatal high-dependency units, including the provision of equipment. The money will also support continued training for doctors and nurses for the neonatal units, among other things. Another significant capital project being implemented this fiscal year is the institutional strengthening to improve national surveillance, prevention and control of infectious disease project. $28.75 million is earmarked to, among other things, finance a national preparedness plan and roadmap for the potential threat of the Ebola virus. And under Project Inner City, $4.3 million will be spent to address drug abuse through public education. Those are some of the ways the Ministry of Health will be attending the health needs of the nation this fiscal year, safeguarding the health of the people and the wealth of Jamaica.
Don't make diseases spread. Wash your hands with soap and water instead. Wash them regular or use a hand sanitizer. Make sure the germs them dead. Touching your eyes or your mouth or your nose. Wash your hands before you do things like those. After you use the bathroom before preparing food, come on, wash your hand them clean.
How we treat with and dispose of or even utilize wastewater is important to the sustainability of our environment and our health. The University of Technology is partnering with the National Water Commission to conduct pioneering research on wastewater management, which should ensure a safer environment. Let's find out more.
Waste, traditionally defined as unwanted or unusable material, is becoming very important to society. As populations face increasing needs and depleting natural resources, waste products are proving useful. Think of items like paper and cardboard made from trees, natural resources that could easily be overexploited. If we can recycle the paper already made, we can minimize the number of trees that are cut down. It's for those reasons and more that the University of Technology UTech decided to open a waste management center. UTech's Waste Management Center, the first of its kind in Jamaica and the region, was officially opened in March 2016. Built at a cost of $62 million, it was entirely funded by the university. Equipment and other resources are valued at $40 million. The center boasts 3 laboratories which are being upgraded to receive international recognition through ISO certification. UTech's Waste Management Center seeks to contribute to Goals 1 and 4 of Jamaica's Vision 2030 development plan by providing world-class education and training and facilitating the sustainable management and use of natural resources.
The center aims to be the heart of a larger outreach program to Jamaica and the other Caribbean countries by providing a diverse suite of services, such as training, risk assessment, hazardous waste treatment and disposal, waste minimization studies, wastewater treatment plan commission and evaluation, and so on and so forth.
In addition, the center will be a source of income for the university. One of the flagship programs offered by UTech's Waste Management Center has to do with wastewater.
How can we improve levels of wastewater treatment? How can we recover nutrients from treated wastewater? And how we can expand the potential for treated wastewater reuse, especially when we consider the extreme water shortages being faced not only here in Jamaica, but throughout the region.
Plus,
drugs, pharmaceuticals, hormones, microplastics, they're finding their way into our water supply, and traditional ways of management of wastewater or treatment of wastewater are not necessarily addressing these.
And so UTech, through a partnership with the National Water Commission NWC, the National Environment and Planning Agency, and the Caribbean Regional Fund for Wastewater Management, is embarking on a project to conduct further research and training in wastewater management. So far, about 85 operators and engineers have begun training. But how important is wastewater to the NWC? Well, the entity collects and treats sewage for approximately 25% of the population at 68 wastewater treatment plants.
We are currently undertaking several waste-related projects island-wide, not only because of our recognition that proper waste management will safeguard our public health, preserve our environment and support our economic development, but also because we recognize that wastewater is a valuable resource if properly managed.
For example, sewage effluent can be a valuable nutrient source for plants.
I believe in the early stage of plant growth, sewage effluent ought to be given the prominence and the importance in our water resources going forward.
With those plans in train, the NWC will be working closely with UTEC's Waste Management Center.
Our hope is that establishment of this Waste Management Center will go a far way in advancing knowledge, disseminating information relating to waste management, and more specifically for the NWC, wastewater management and its reuse. Serve to offer integrated solutions that promotes the economic benefits of waste management for Jamaicans.
Overweight is defined as having an excess amount of body weight, but that can occur from increased amounts of muscle, bone, fat, or water, whereas obesity is defined as having an excess amount of body fat.
The excess fat that leads to a diagnosis of obesity mainly occurs when the body takes in more calories from foods than it is able to burn through exercise and normal daily activities. The result is a major health threat, as obesity is usually accompanied by other issues such as type 2 diabetes mellitus and non-communicable diseases such as hypertension, heart disease, stroke, and various cancers.
Obese men are more likely than non-obese men to die of cancers of the colon, rectum, and prostate, and obese women are more likely than non-obese women to die of cancers of the gallbladder, breast, cervix, uterus, and ovaries. There are other conditions like gallbladder disease of different kinds, which are associated with obesity.
Infertility and poor quality of life can also result. So diagnosis and management of obesity is of enormous significance.
And there are ways to assess it. The commonest way to assess obesity is by using what we call the body mass index, or BMI. And the BMI is essentially your body weight in kilograms divided by your height in meters squared. And we have scales to judge what your weight status would be. Less than 18.5 BMI would be considered to be underweight. Normal weight is 18.5 to 24.9. 25 to 29.9 would be considered to be overweight, and BMIs of greater than 30 are all considered to be obese.
It's generally easier to gain weight than it is to lose it, which means avoiding practices that lead to excess fat consumption is the easiest route to avoiding obesity. But if you're already overweight, the process may be difficult, but it is achievable. You may need help from physicians, nutritionists, physical trainers, and even therapists, so you should seek them out if that's the case. Either way, most experts will tell you that weight loss requires behavioral change, lifestyle changes that are gradual and long-term.
The problem in our society, of course, is the same as anywhere else. Less physical activity, we're working harder, we don't have time to schedule exercise, and of course, unhealthy eating habits. So more fast food, less fruits and vegetables, less freshly prepared foods, and consumption of large amounts of sugar-sweetened beverages. So this is what fuels it.
Eating healthy helps to keep us healthy. Are you thinking about what would be a healthy and balanced meal, but just can't decide on what foods you should be having? Jamaica's food-based dietary guidelines can provide you with answers. The guideline from the Ministry of Health provides information for individuals, health professionals, nutrition educators, and the food industry. It encourages a daily diet of items from all the food groups. That should include fruits and vegetables, as well as peas and beans and nuts. And the things we ought to avoid are clear. Excess salt, that is more than the daily recommended amount, as well as fats and oils and sugary foods and drinks. Also,
If you lead a sedentary lifestyle, then it's very easy for you to become obese because you're not going to be able to burn off the calories that you take in. And of course, if you eat unhealthily, you're more likely to become obese because your body's going to store all these excess calories as fat.
So one of the ways to counteract obesity is to engage in regular physical exercise, like going for brisk walks, jogging, swimming, or riding a bicycle. Regular exercises like these burn calories and get rid of excess fat and weight, helping to control blood cholesterol, blood sugar, and even high blood pressure. Experts in health services say children can be set up to become obese later in life. The Ministry of Health is working to address these issues as it focuses on key strategies to improve overall maternal and child health services. Don't be weighted down by obesity. Take charge of your good health. Eat well, exercise, and get about the business of living well.
Top stories from the week, next.
Hi there, I'm Simone Wolf with your JIS News of the Week. Finance Minister Audley Shaw has assured the country's international partners of Jamaica's commitment to the economic program under the Extended Fund Facility with the International Monetary Fund, the IMF. He gave the assurance as he attended the annual IMF World Bank Spring meetings in Washington, D.C. in the United States. The minister discussed a wide range of issues with the IMF, IDB, and World Bank, including financing and technical assistance in the areas of tax reform, public sector reform, and energy reform, as well as other government initiatives. As for Jamaica's agreement with the IMF, Minister Shaw advised that all quantitative and structural benchmarks for the December 2015 quarter were met, and that indications point to the same for the March 2016 quarter. In May, an IMF mission will arrive in the island to review both quarters since they were not able to conduct a December review in February due to the general elections. Prime Minister Andrew Holness has reiterated that the newly formed Ministry of Economic Growth and Job Creation is working to cut bureaucracy and fast-track investments on the island.
To put under one umbrella all the critical agencies needed to make decisions, so that the pathway to decision is clear, so that the number of decision makers are lessened, so that from the time of conception to the time of fruition is short and beneficial.
Starting September, high school students will no longer have to pay auxiliary fees. Education Minister Senator Ruel Reid says an additional $2 billion will be provided across 2 budget periods to fund the policy change.
So effectively, we'll move the contribution to schools in a range of the current $11,500 to $19,000. What we've said, we are going to meet with all the stakeholders, the principals, and I'm sure they'll have thoughts for the JTA to see how we can model this additional resources, and that the term auxiliary fee and the request for auxiliary fees can in fact be extinguished as we look at other options to ensure the system is fully funded.
Public sector pharmacists this week became the latest group to accept government's 7% wage offer for the 2015-2017 contract period. It's retroactive to April 1, 2015. Minister of State in the Ministry of Finance, Rudyard Spencer, said the majority of claims were settled, including the payment of a transportation allowance.
What is of importance is that the pharmacists, they are not really traveling officers, but they perform a very serious service in that they use their own transport in the dedication to the provision of care to the Jamaica populace, use their personal motor vehicles to transport supplies and provide the necessary service so critical for those patients.
Health Minister Dr. Christopher Tufton announced this week that he would be setting up an advisory committee to improve efficiencies in the pharmaceutical sector. He said it would require partnership to improve the delivery of pharmacy services.
That partnership and that approach to ensuring that our role is enhanced in terms of efficiency to help you to do your work, I believe could be greatly aided by having some sort of an advisory group that involves members of this fraternity and others to look at some of these difficulties and address these difficulties.
National Security Minister Robert Montego has ordered an audit into Jamaica's capacity to detect and counter acts of terrorism while protecting the country's borders.
We are faced with a terrorism threat. We are faced with a cyber attack, and our borders are porous, and many things are coming into Jamaica not from the recognized ports. And therefore I've asked for that audit and the requisite recommendations, because we have to be proactive. We cannot wait until there's an incident, then we react.
The minister was responding to concerns at a town hall meeting last week in St. James. 31 new recruits have been added to the municipal police force, charged with enforcing municipal laws and regulations and the maintenance of public order.
And in executing your responsibilities, you're going to come across friends, even sometimes family members. But remember, the law does not carry color. You can't be partial in the execution of your responsibilities.
The new recruits joined the municipal police force after being trained at the National Police College under a partnership with the Ministry of Local Government. And finally, the Labour and Social Security Ministry has advised that there has been no reduction in the benefits provided by the PATH program. The clarification came in response to concerns expressed by some beneficiaries recently. The ministry says beneficiaries who have queries about their payments should contact their parish office. And those were some of the stories making news this week. I'm Simone Wolf.
Householders, business people, school administrators, be on the alert. Help control the mosquito population. Destroy breeding sites. Empty old tires and all other containers where water can settle. Bore holes in old cans. Cover water drums and garbage cans. Wash flower pots and vases and clean pet dishes regularly. Protect yourself from mosquito bites. Cover your body as much as possible and use mosquito repellent containing DEET.
Experiencing flu-like symptoms such as coughing, fever, or runny nose? Has it caused severe aches and pains? Is it difficult to breathe? Have you been feeling dizzy? What about diarrhea, vomiting, or dehydration? If the answer is yes, see your doctor or the nearest health center right away. These are all symptoms of the influenza A H1N1 virus. Be smart. Seek medical attention today.
Building your knowledge base to become educated and skilled is an important factor for success. Also important, keeping fit and healthy. The JIS team has been supporting this aspect of development for boys at the Mount Olivet home through sports. Take a look.
The heavens approved and the weather was good for a fun-filled day. Staff members of the JIS, family members and friends were making the usual visit to the Mount Olivet Home for Boys in Manchester for their annual sports day. Over the years, the team has been redirecting some of its energies towards the wholesome development of about 30 wards of the state through a number of interventions.
The Mount Olivet Boys home here in Walderston, Manchester, is the JIS's corporate social responsibility project. It was selected by members of staff. We assessed the needs. We came together and we decided that we would adopt this home 6 or so years ago.
Along with helping out the home with food and clothing supplies and assisting with the general upkeep of the facility, since 2009, the JIS team has also been providing encouragement and mentorship for the boys.
It makes us feel good as members of staff, as a JIS family, to know that we're giving back, we're investing in a boy's life. And right here we have so many boys that are in need of comfort and encouragement and mentoring, and we just want to be able to give back and invest in their lives.
Every April, sport is drafted into the mix. Mount Olivet Boys and JIS staff, past and present, all look forward to the activity-filled trip. On the modern play areas, created courtesy of Johan Blake's charity, they gather. Red, yellow, blue and greenhouse, all revved up for some friendly competition in the contest of agility, dexterity, balance, coordination and strength, and other skills? At the end, Greenhouse came out victorious with the most points, followed by the competitive red, yellow and blue house teams. But everyone got the main prize.
From what we have seen, the boys have enjoyed the whole setting for today. This is something that they look forward to each year with the JIS.
The JIS Mount Olivet Sports Day was not complete without the cake and cheers for those who celebrated their birthdays since our last trip, specifically the January, February, March and April people. It was all only made possible due to the support of numerous sponsors and partners like Why Be Afraid and Wysinco, Maxfield Bakery, Coldfield Manufacturers, Tasty and JUTC. With their help, the JIS team visits the home multiple times per year to mark and celebrate milestones like the new school year, Easter and Christmas. And while Sports Day 2016 is now history, the year-round support still flows as preparations are in gear for an upcoming visit in August to continue supporting the growth and development of Mount Olivet's boys.
Each time you're not paying full attention to the road environment, the greater your chances of getting in a crash like that. Plan routes to avoid focusing on GPS systems, prevent children from roaming in motor vehicles, turn down the volume of car stereo systems, pull off the roadway if you have to use mobile devices, do not read, watch television or eat while driving, avoid multitasking, and keep conversations with other passengers to a minimum. Whether you walk, ride or drive, avoid potentially fatal distractions.
And that brings us to the end of today's edition of Jamaica Magazine. We value your feedback, so keep the link. Tell us what you thought of the show. Send an email to jamaicamagazine@jis.gov.jm or hit us up on Twitter @JISnews. Also, click on our website jis.gov.jm for more programs and our YouTube channel Watch JIS. Until next time, I'm Tamara McHale reminding you to take care of your health. Eat well, exercise, get adequate rest, and make every day a productive one.
This has been a production of the Jamaica Information Service, the voice of Jamaica.